Diabetes patients will now be able to access healthcare at an affordable price following interventions by a Danish firm to supply low-priced insulin to the country. The firm Novo Nordisk, in partnership with the Ministry of Health and Royal Danish Embassy, has today launched an affordable insulin project dubbed iCARE as the world marks 100 years of insulin.
The currently launched project targets diabetes patients of low socioeconomic status who usually receive medication from public health and faith-based facilities on a project timeline of 3 years. Dr. Ephantas Mare, head of Division of Non-Communicable Diseases Prevention and Control, says the project aims at reaching over 8,000 patients and 500 healthcare professionals.
This project is particularly looking at people who are not able to access insulin, especially type 1 diabetes patients who are above 23 years, who are not working and who cannot cannot be able to buy insulin. So this project is going to provide insulin at an affordable cost among that population, and also people over 60 years and people who come from low socioeconomic areas like the slums and other hard areas to reach. So we are targeting about 8,000 people countrywide with this project. If we get more than that, we'll be happy. But right now we are working about 8,000 people to ensure that they have affordable insulin and they're able to control their...
Vinay Ransiwal of Novo Nordisk says the iCARE project is to halt and bend the rising curve of diabetes cases in the country.
And to defeating diabetes, we need to drive change, but the change is not possible by any single player. Not by Novo Nordisk, not by... We need to collaborate together. So everyone brings their expertise, okay, their solutions together, those multiply and it becomes multifold. And then if we have the heart in the right place, that we think from the lens of what the people with diabetes needs in terms of support. So this is where the genesis of this program called iCARE.
The cost of insulin in the country is unaffordable to many diabetic patients, with now the economic power of many affected by the onset of COVID-19 pandemic. According to health experts, between 347 and 422 million adults are affected by diabetes around the world. In Kenyan adults, the national prevalence of diabetes is projected to rise to 4.4% in 2035. For Channel 1 News, I'm Otiende.